Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Well, we've all heard that part of the aging process is that you'll probably get sore and achy joints, but you just have to deal with it. And I certainly disagree with that outlook, and I recognize that there's many things that we can be doing as we get older to maintain the health of our joints. And certainly there are many different nutrients. We can look at just starting with our diet, knowing that there are many foods that can be beneficial to the way that our joints age. Certainly activity, trying to stay physically active. There are interesting studies out there showing that people who have arthritic joints actually improve upon their symptoms when they do physical activity, even though in the beginning it generally is quite uncomfortable and even painful for many people. But the more we can keep that motion going within that joint, the better off we are. And we talk oftentimes about different nutrients that come from our diet as well as supplementation that can be very supportive of healthy joint function. But have we thought about it in the setting of actually preserving the joint structure itself? So not just maintaining and trying to ease the inflammation and ease the discomfort, but actually taking the steps to preserve the joint structure and to support the cartilage. So that's what I want to talk about today. I am Amanda Williams, MD, MPH, and I want to talk about two different things that are combined together, and many people have heard about it, and that's glucosamine and chondroitin. And what in the world are glucosamine and chondroitin? Well, they are endogenous. They are the major components that make up our joint structure. So when we think about the components of cartilage, we know that chondroitin helps to retain water. So it's made in the body naturally, and it certainly does a lot in terms of the proper function and the movement of the joint. Now we have glucosamine. This is like chondroitin. It is a natural compound found within healthy cartilage and particularly in the fluid around the joints. So we know that glucosamine has many different properties to it, even more so than chondroitin. It has been shown to have anti-inflammatory properties. And it even has been shown to help cartilage regenerate itself. So when we combine the two, so remember, they're naturally occurring in the body, but it seems that the glucosamine really packs an extra punch to it. So I want to talk about the way that researchers have now recognized the way that glucosamine is actually working in the body, because it's really quite novel. And when we think about endogenous things in the human body, there are so many of them, and they all play such critical roles. I mean, we can look at things like coenzyme Q10. If we are lacking CoQ10 production in the human body, that's certainly going to affect our cellular energy output, which can affect many different things. So when we look at glucosamine and chondroitin, and we recognize if we have insufficient levels of these, this can lead to further destruction or more rapid destruction within the joint spaces. But also, we now realize that if we're lacking that glucosamine, we can actually drive up more significant amounts of inflammation. So there's been some interesting studies that have come out. One that I just want to point out to you was from the American Journal of Clinical Nutrition. This was back about a decade ago. And researchers at University of Washington School of Public Health, along with the Fred Hutchinson Cancer Research Center, were looking at how there was a lower risk of death from all causes among folks who used supplements for arthritis. And what were the primary supplements that they were using was glucosamine and chondroitin. So they had to take a step back and say, okay, well, we've assessed over 77,000 men and women between the ages of 50 and 76 years old. And within this group that they tracked over a period of time, they started to see a trend. And they were looking at their dietary intake, their exercise, the different lifestyle choices that these folks made. Did they smoke? Did they drink? All of those different things. But they also did a questionnaire on dietary supplementation use. Do you use multivitamins? Do you use antioxidants such as vitamin C and vitamin E? But the one area that really popped out to them was that glucosamine users, so those who took glucosamine and chondroitin supplementation, because it's usually combined, but glucosamine in particular, that they had an associated 8% lower risk of dying for those who used glucosamine. Now, those who used glucosamine and chondroitin on a regular basis, like every single day, they found that that risk was closer to 20% lower risk of dying. So you have to think, okay, so if glucosamine and chondroitin are part of what makes up the healthy cartilage and supports joint function, well, it must be doing something else, because if it's actually targeting all-cause mortality, and they find that people who take glucosamine and chondroitin on a regular basis had a reduced risk in all of these different types of mortalities. So what is it that they were able to narrow this down to? Remember, glucosamine has been shown to have these anti-inflammatory properties. Well, what they were able to actually hone in on was really remarkable. And they found that the glucosamine and chondroitin could actually inhibit NF-kappa beta, which is nuclear transcription factor kappa beta. And why is that important? Because we know that NF-kappa beta is that master driver of inflammation that has been directly associated with cancer and so many of the different inflammatory diseases out there. So glucosamine and chondroitin, they partner up. You're taking it for the health of your joints, but they're actually doing more than that. And in particular, it's really that glucosamine. So I think that that's really quite novel. So another bit of research came out, and this was published in the American Journal of Epidemiology back in 2012, showing an association between supplementation of glucosamine and a reduction in C-reactive protein levels. So what do we know about CRP? Well, we know CRP is looking for systemic inflammation. And they found that those who had, this is assessing once again over 9,000 men and women, they found that those who had regular supplementation, at least 20 days per month of using glucosamine, that their CRP levels were close to 20% less than those who did not. So that's pretty impressive stuff. Now we can look at it and say, okay, well, we know that it's targeting inflammation. Well, have they ever looked at using glucosamine and chondroitin and compared it to an NSAID, for example, the non-steroidal anti-inflammatory drugs? Yes, they have. So in the Annuals of the Rheumatic Diseases Journal, they did a study, and they were able to show in that study that glucosamine and chondroitin was as effective as the NSAID drug celecoxib. And why is that important? Because celecoxib is actually a prescribed one. That is a COX-2 inhibitor, so even stronger than, say, your typical ibuprofen that you would get. And in this randomized double-blind trial, which was called the MOVES trial, M-O-V-E-S, MOVES trial, they took over 600 men and women who had knee osteoarthritis, who complained of moderate to severe pain. And they gave them either the glucosamine and chondroitin or the celecoxib. And they assessed their pain, their function, the stiffness, the swelling, And the group that was taking the glucosamine and chondroitin did remarkably well. Now, here's a more recent study. And this one, once again, from the Annals of Rheumatic Diseases in 2017, where they were able to show that chondroitin alone was just as effective as Celebrex, which is that celecoxib. And in this study, they were looking at over 600 men and women, once again, with knee osteoarthritis. So when we realize that this endogenous component that makes up the structure of our joints, that cartilage production, glucosamine and chondroitin, and then we start to expand out as to just how powerful these actually are, then you can start to think to yourself and say, wow, why don't I hear more about this? Now, a lot of people know someone who has taken glucosamine and chondroitin, and they say, oh, I've tried that. It didn't work for me. I always say, when someone says that, doesn't mean that it's not working, because remember, we're replenishing what we know is already lost. But it may be that the main component to their discomfort within their joint, in the knee or hip, could be more of a synovial fluid issue, in which case hyaluronic acid may potentiate better benefit. And then you also have to look at too, are you just trying to take glucosamine and chondroitin without combining that with a healthy diet and proper exercise? So there's a lot of different factors, but what we do know is that glucosamine and chondroitin certainly play a major role in retaining the structure of those joints. But they do so much more than that, now that we realize that they're actually targeting inflammation. Glucosamine, as a matter of fact, has shown to have actual neuroprotective effects by suppressing inflammation in the brain. Once again, targeting that NF-kappa beta activation. So this is one of the areas that they researched. The anti-inflammatory effects of glucosamine were attributable to its ability to inhibit NF-kappa beta. So this was published in the journal called Glia. So that's when we're thinking brain health, the glia. Some people have heard of microglia, for example. But when we take a step back and we realize that there are things in the human body, and we, pinpoint it down to just its one function, that's usually not the case. And glucosamine and chondroitin are a perfect example of this. We are now recognizing that there are many different functions of glucosamine and chondroitin in the human body. And in the Journal of Cancer Causes Control, they were assessing in the VITAL study, VITAL, the use of glucosamine and chondroitin when it came to lung cancer risk. Now, once again, remember, NF-kappa beta, we know that's one of the biggest drivers when it comes to cancer. And inflammation is not a good thing in the body when we're dealing with cancer. So in this particular study, and the VITAL study is the Vitamins and Lifestyle study that was conducted in the state of Washington. And they were looking at folks between the ages of 50 and 75 years old, and they tracked them over a 10-year period. They once again came down to seeing the use of glucosamine and chondroitin, but what they found was that those who had this high intake of glucosamine in particular had a reduction in lung cancer risk. So, and this was limited to adenocarcinoma of the lung. Now, that's really quite interesting to see that people who were taking glucosamine and chondroitin for the health of their joint were actually yielding this dual benefit in terms of targeting NF-kappa beta, which downregulates and makes it more difficult for cancer. So this is why I just kind of wanted to talk about glucosamine and chondroitin in just a broad sense today, because when we think about joint health, obviously we all want to have our joints feel good. You don't want to have to get up and feel like your joints are stiff and it takes you a while to get going. And you want to be able to enhance the flexibility and the mobility and the stability within the joint. And we know that glucosamine and chondroitin, both of them, play a really critical role in this. But now we recognize that it is beyond that of just preserving the healthy joint structure. We now realize that glucosamine in particular is very, very targeted towards COX-2 pathway, COX-1 pathway, and that critical downregulation of NF-kappa beta, which is incredibly impressive. So by taking something for our joints, we're actually getting systemic support, driving down systemic inflammation. We can see that with CRP levels going down. We can see in clinical research how that glucosamine is actually supporting brain function. And now we see it in the setting of lowering the risk of certain cancers. So wanted to bring that to your attention today, and that is all that I have for you. But I do want to thank you so much for tuning into the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.